Hi, my name is Dr. Jam. I'm an implant and aesthetic dentist based in Liverpool, and I've been working in my practice for over 5 years now. Turkey teeth are teeth that are often made in one day, and it often involves a lot of destruction of the patient's own teeth, or if they are having teeth removed, implants may be placed in a single day, often very white, very bulky, and done very quickly at a low cost. Often the dentist abroad will take an x-ray, they'll take the patient in, and everything will be done in a very short space of time. The patient will be staying over in Turkey, maybe in a hotel, and then they're sent back to the UK, often without any aftercare or instructions, and the work's completed but the maintenance isn't. So yes, my opinion on this treatment, I think the way that those dentists are taught over there in Turkey is slightly different to how they're taught in the UK. That includes the techniques that they are taught as well. I don't often criticize those techniques or the work that's done or the treatment that's carried out, purely because that's the way they are taught. In the UK we are taught differently, and what that means is when that work is done abroad and is brought back here into the UK, often the UK dentists are faced with challenging situations where they might not know the material that's been used. If implants are used, they won't be familiar with how that ceramic is placed on different teeth that are done, and that can present challenges and problems, and it's very difficult to troubleshoot and to correct and fix these things. So in my opinion, I personally wouldn't recommend the patient goes abroad to have this work done unless they intend to stay out there for these solutions to be provided to them if they encounter a problem. Often this treatment is attractive to patients because of financial aspects. The cost is often very low compared to similar treatments in the UK. One thing I would say though is treatment options presented to the patients are different here to what they are over in Turkey. So for example, you might see patients who've had full arch veneers or big bridge that's connected and all joined, whereas in the UK there may be an option to do some clear aligners, some whitening, some bonding. That might be one option. You might have the option of crowns and veneers, and then for implants often you'll see many teeth removed, if not all of the teeth removed, and implants just placed without actually taking into account teeth that might be able to be saved. And again, what I'd say here is we look at the longevity of the teeth. So the longer those teeth actually last, the less need for them just to jump to implants, because implants is almost like a last resort, because implants are used to replace teeth. They're not a substitute for teeth, because patients' own teeth is the best thing that they can have. So losing it is a last resort. So yeah, cost is one thing, and then the other thing is how quickly these treatments are done. They're often done very quick, very fast. And I think if you combine the two things, for a patient, cost and something done very fast, it's really attractive. So a lot of patients who have this treatment are often patients, for example, who come to my clinic in Liverpool and are asking to have something done for a specific reason. So wedding, holiday, big life event such as a big birthday. So I see a lot of patients who have thought about going to Turkey but actually come to me in Liverpool and say, actually Dr. Jam, I didn't go to Turkey because I wanted to speak to you. I wanted to know whether that's the best thing for me to get done and what my options are. And often, you know, these guys have researched because they know it's much cheaper to go abroad and do it over there, get it done quick, get it done cheap, and they know what's going to happen almost. But then when they speak to us, we'll go into a little bit more detail, but then I always go back to cars. I like talking about cars, and I say, look, if I buy a Porsche, do I then go and take that to a Fiat dealer or a Toyota dealer or a Ford dealer? I don't, because those manufacturers, they don't know how to service the car, they can't repair the car, they're not allowed to even touch the car because they're not insured to do it. Dentistry is the same, so we are not insured to touch that work once it's done abroad because we can't be liable for it, and we are not in a position to fix those problems because we don't know what the problems are. We don't know what materials been used, we don't know what implant systems been used, we don't know how the implants are placed, we don't know if there's any bone grafting. So we go into all that detail, and that car analogy is the same. Even with maintenance, when you're servicing the car, it's got to be serviced at that main dealer, not in another dealer, because they won't touch it. We're based in Liverpool, and we see patients who've had work done abroad in Turkey, and then they come to us and it's gone wrong, and we've had to dismantle it and start again. And if you think you're a patient, you're paying twice. You're often paying quite a lot more here to correct the work that's gone wrong. Yeah, I wouldn't recommend it, and 100% I'd at least go to another dentist in the UK first, get an opinion, get a list of your treatment options, and then decide what you're going to do. Thank you everyone for watching me speak about dental implants. If you like what you see, please like, comment, subscribe to this. It's been a pleasure to speak to you about dental implants. Hope it answers all your questions and queries. Thanks again everyone.